Hello, I'm Juliet Chastney, Project Manager for the Literal Project. Welcome to this webinar, Bringing Our Authentic Self to Work. It's great to have you today. If you'd like to quickly say hello in the question and answer section and say where you're from while I'm speaking, that would be great. This is the fifth in a series of 6 webinars on topics relating to spirituality and religion as experienced by ethnically diverse NHS staff during the COVID-19 pandemic. These webinars are part of the Literal Project, which is a study funded by NHS England, and we have been conducting consultation groups with ethnically diverse NHS staff up and down the country to explore their experiences and guide us towards the topics for these webinars. How today's event will work is our speakers will have a discussion with each other for the first 30 minutes or so. Then we will open up to questions and answers. Everyone attending this webinar has their camera turned off and their microphone on mute. If you would like to ask a question of our speakers, please type into the Q&A section and Guy will discuss them with Reena a little bit later. Please type your questions in as soon as you think of them while we're still talking, as there is a delay before we can respond. All of these webinars are being recorded and will be available on our webpage later. Our speaker for today is Dr. Reena Vohora, who is a chartered clinical psychologist, academic tutor and mentoring lead on the doctoral course in clinical psychology at the University of Oxford. Reena has also been co-chair of the Race Equality Network at Oxford Health NHS Foundation Trust for the past 4 years. Reena's work has included coordinating events, delivering presentations and providing training on cultural considerations in academic, clinical and media settings. She's also supervising a number of doctoral research projects relating to service considerations for patients from ethnically diverse backgrounds. Reena began working in the NHS in 2005 and has worked in a range of inpatient, rehabilitation and community-based mental health services and settings. She is responsible for the coordination of the Equality, Diversity and Inclusion teaching on the Oxford Doctoral Training course. She teaches on a range of topics, including issues relating to clinical skills and professional practice, diversity and inclusion and resilience. Thank you for being with us today, Reena. Joining her in conversation is Reverend Dr. Guy Harrison, Director of the Oxford Centre for Spirituality and Wellbeing and Project Lead for the Literal Project. Over to you, Guy and Reena. Oh, I think you're on mute.
Thank you very much, Juliet, and I was then on mute, that's fine. I would like to add my welcome to you, Reena. Delighted to have you with us, and a very interesting topic, bringing our authentic self to work. Perhaps I'd like to just invite you to introduce the topic, and we can have a conversation about probably the first place is probably to define what authentic is, but over to you.
Thank you very much, Juliet and Guy. Really pleased to be here, and I think it's such an important topic. And for me, I think today really brings together some themes from the other webinars that have happened so far. And interestingly, I guess I do quite a lot of teaching, but I've just reflected on the process of today, and for me, it's actually going through thinking about this area has actually brought up a range of questions that I'm still thinking through. So I think I'm really keen to have discussion around this today, around what it actually means to bring your authentic self to work. So as you say, Guy, I think a really helpful starting point is actually to define what we mean by being authentic and the importance of this as well. So we know that if we can be our true authentic selves at work in different domains of our lives, it can create better environments, it can enrich our experiences for ourselves and others around us as well. So I think it's really, really important that we do consider this in our kind of professional lives. And in terms of doing some research for today, I tried to ask a range of people how they might define being authentic or see being authentic. So I can read through some of those responses. But whilst we do that, I guess I'm very aware that often we come to different meetings and webinars having rushed from other tasks. So just as a way of getting us actually to think about this topic, whilst Guy and I are maybe thinking about the definition, I was going to suggest whether people might like to take a few moments as we're talking to think about what the term authentic means to you, and also what being authentic means. And if anybody would like to drop any comments in the chat box, that would be really appreciated, and we can come back to that. So I guess if I start first with a bit of a dictionary definition, also just to explain, in preparation for today I did prepare some slides, so I might be looking to the side a little bit, but we decided to have this more as a discussion, so do excuse me, but I'm just going to have a look at this. So one of the dictionary definitions of being authentic came up as being worthy of acceptance or belief as conforming to or based on fact, made or done the same way as an original. And then the definition went on to say being true to one's own personality, spirit or character, and being authentic with no pretensions. So just in itself, I guess that made me think about the first example of the definition, the first part of the definition talked about being the same way as an original. And I guess that made me think, what is the original? If we're thinking about being in the workplace or professional roles, does that mean we have a sense of what it might be, what it might look like to be in a particular role, or the particular behaviours or expressions of sort of our character that are expected in certain domains, and what might that be like if it perhaps doesn't fit with who we feel we are as our true self? So I suppose it started to make me think about how we might be authentic in the workplace. So I guess for me, it's made me think about what makes you as being an important question. And when we're thinking about what it means to be authentic, so if I just go through some of the responses that I received when I asked this question of others, there's some of the responses I received was just be you and try not to worry about the opinion of others, taking on challenges and seizing every opportunity. This would mean that I feel valued that I feel valued and I don't feel judged, and my personal interests and myself are accepted. Not letting the fear of judgment from others hold me back. Being able to voice my opinions openly and feel heard. Sharing when you've not made the right decision. Allowing yourself to be empowered when surrounded by others who know more than we do. So there was quite a range, I guess, of experiences. Thank you. I can see some responses coming through too. So I can see a response. So to be who I am, as I am, and how I see and engage in the world. And I think some other people are introducing themselves, so thank you. And I think for me, just when we're thinking about this, I guess when we're thinking about what it means to be our authentic self, it's that sense of what we say, what we do and how we act being aligned with our values and our true sense of who we are as individuals. So our authentic self for me means perhaps not being defined by particular roles and having the freedom to express ourselves, and perhaps not responding to the expectations of others or this sense of having to please people. And I think it's really interesting because when we are first born, when we're growing up, we tend to be very free. We tend to be free of maybe being aware of some of the biases or prejudices or pressure that is around us in so many different forms. But as we grow older, we become very aware of societal pressures, of messages, of bias, of stereotypes. And I guess I wonder whether that might impact on how we feel able to present ourselves or be ourselves in different environments. And I think as we go through this, it would be inappropriate not to acknowledge the fact that there is racism that exists, there is institutional racism, with that something that we have to consider within NHS settings too. So I think it's important to to just put that out there and be transparent about that, but also then think about how that might impact on us feeling able to be our true, authentic self. I'm aware that I've talked quite a lot there, Guy. I don't know whether you want to chip in.
No, that's fine. Thank you, Reena. I think you posed some interesting questions in terms of both definition. It's about confidence, isn't it? I think, you know, how we feel confident enough to be able to be authentic, whereas many people, particularly within our project, we've discovered that actually many people from ethnically diverse contexts don't necessarily, because of the either overt or inherent racism that is there and discrimination, don't feel that confidence. So it actually affects the way we are, who we are, and how we present ourselves. I think being authentic for me is sometimes a risky business. It's that sense of because we have a sense that sometimes we want to please other people, we want to please our managers, we want to please our patients, our clients. So that's very helpful.
Thank you, Guy. And I suppose it makes me think of the work of Brené Brown, who talks about actually being authentic, taking a lot of courage, because it means that we put ourselves in quite a vulnerable position. We are putting ourselves out there, which might not always feel easy to do based on perhaps previous experiences or settings that we might be in. So when we're thinking about being authentic at work, I think this is about, if we think about the environment and settings that allow us to do that, I think one of the key things to think about is the foundations of the relationships that we have with our colleagues and how comfortable we feel in different settings too. So this idea of building a sense of safety and trust within our teams, within relationships with colleagues, to allow us to be our true selves in our work setting. And for me, I think it's that sense of connection and communication with each other being key. I think sometimes we can perhaps worry about saying the wrong thing or using the wrong terminology, which sometimes keeps us from having those really important conversations. So I think you're right. I think it can feel uncomfortable, or it can make us worry, because it does take courage to put ourselves in those situations where we can be vulnerable.
It does, and Ginny has posed a comment in the questions and answers. She says, is it authentic to be honest about how I'm feeling in the moment? Is it acceptable for me to be grumpy, upset, angry when working in a healthcare setting, or do we always have to make ourselves presentable? Which is a really good question in terms of that sense of being true to ourselves. How can I, because sometimes people will know that I do get a bit grumpy, but can I really acknowledge that both to myself and to others and feel safe? And Steve's also saying, isn't it hard to be ourselves in our work setting, that we need to check our instincts and nature to be taken seriously, and behaviour. And that's the whole thing about the professional, isn't it? You know, we were talking earlier, the professional doesn't necessarily, or the stereotype of the professional is that they don't necessarily reveal very much about themselves. You kind of have that blank screen that you can present to people. So I don't know if what do you think about those comments, Reena?
Yes, no, thank you very much. So I guess to take Ginny's point first, I think it's really important to be able to reflect on how we feel as healthcare professionals, and we are human. It is really important for us to acknowledge that there might be times where we are struggling, where we may, I think in the message it was kind of feeling, so Ginny had put grumpy, upset or angry. I think acknowledging those feelings is really helpful, and it's important. It's about having that reflective space. So, you know, we are not machines. We are affected by the work that we do. And I think it's important that we have that reflective space. I think for me, again, it comes back to that sense of safety. So I'm thinking back to some of my clinical roles where I would hold reflective practice sessions, and I would often start by saying, today I'm not feeling so great, or this happened and I'm really worried about this, or I'm worried about this particular interaction, or something's come up that I'm wondering I should have perhaps done differently. And I think it's about that modelling as well, that actually it's okay, and I think we have a responsibility in terms of that, in terms of our team culture, to be able to bring these difficult conversations to the fore, and to be able to support each other as well. I think it's really difficult as professionals to always leave our home life at the door when we come to work. And I think, you know, being kind and compassionate to ourselves is part of understanding that actually we are going to find, you know, on some days we might feel upset, we might feel tired, we might feel frustrated. But it's, I suppose, how we talk about that and support each other, I think, is really, really important. And I would actually, I think, working as a team, I would worry more if people weren't able to connect that or reflect or talk about that. I would feel much better if somebody is coming to me and my team actually and saying, this is the way I feel, because if we know how we're feeling, we can support each other through that. And then in relation to Steve's point, I think this is something that has really, really come up for me in terms of preparing for today, because I'd started by thinking about what it means to be authentic, and then exactly as you've highlighted, Steve, it's that sense of actually we are employees of the NHS, and there is an expectation and a duty that we have to be able to also uphold professional standards. So does that mean that we are able to be our authentic self? And also, is it appropriate in different settings? I guess one of the things I'm thinking about is political views. So we might have strong political views that we aren't, or that, you know, that isn't appropriate to share in an NHS setting or with patients, for example, or perhaps team meetings. So then do we then hold ourselves back, and are we still being our authentic selves, or is it that we sort of can be more of our authentic self in particular areas or domains of our life? So that's a really interesting question. And then the thing that I then went on to was, how do we define professionalism, and how do we decide that that's appropriate? Is that something that we review together? Is that something that maybe needs to change over time? So I think these are really important questions. I mean, I'd be quite keen to hear what you think too, Guy.
Well, yes, it's something about the culture of an organisation as well, isn't it? But I'd be interested to think a little bit about, because the initial project, as you know, is around understanding the spiritual and religious experiences of ethnically diverse staff as throughout the pandemic, and how we therefore are authentic in terms of presenting our own, what's really core to us as people, which is related to culture or faith or belief or spirituality, and how we do that with confidence, and how we, at what point is it okay to talk a little bit about that, and what point is it not? Are we there, or are we, and we may well find that we're presented with hurdles or walls that actually stop us from doing that, so therefore we kind of retreat, and our confidence levels go, and we feel a little bereft.
Absolutely. And I think we have a responsibility to create those spaces where we can talk about the different aspects of our identity and of our personal selves. And I think it's about having that space to feel heard and understood. One of the things that I was thinking about was in my clinical work with patients, I would often ask if there are things that they might want me to know about that might not be obvious to me, that I haven't asked about. And I guess that often leads into a really helpful discussion about differences that might not be visible and that might not have come up in our conversation, but might be important to the person that I'm working with. And I guess it made me think, do we do that with each other as team members? So we could be working in teams for several years and not really know what might be important to somebody or about somebody's background. And I think for me, in my equality and diversity inclusion role, it's been really useful because it's really made me curious, and I've learned so much more about colleagues that has actually, I think, helped me to build connections. So I suppose just asking that question, are there things that I might not know about you that you think would be important for me to know? I think is a really helpful way of opening that discussion. And equally, I think it doesn't necessarily put people on the spot, because we're not asking about specific kind of characteristics or beliefs, but it's more of an open question. One of the other things that I was reflecting on was whether there is something about confidence, and thinking back to earlier in my career, I probably did shy away from questions around belief and faith, whereas now I feel much more able to speak about it openly. I think I naturally have a curious mind, so I'm Hindu by background, but I have the most amazing family who are very supportive and very open-minded. So I grew up going to a Hindu place of worship, so mandir, with my family. My grandma converted to Sikhism, so I used to go to a Gurdwara, and my auntie converted to Christianity, and when we used to stay with her, we used to go to Sunday school and go to church. So I was really, really fortunate in that I was really supported to be curious, to go into different places of worship, to ask questions. And I think that for me has really been helpful. But if I reflect back sort of 10 years ago, when I was perhaps fairly new to the career, I didn't feel comfortable to talk about that, whereas now it comes much more easily. And I wonder whether there is something about confidence, and also thinking about experiences that we've had. So I've had quite positive experiences of being able to discuss that, but then I'm also kind of thinking, has that been a nature of the team, or has that been because I've perhaps engaged in some sort of modelling where we're able to open up discussions and encourage other people to join in too? So I think there's a few things there. Did I answer your question, Guy?
I think you did, but there's some that we can come to some good questions in a few minutes perhaps, but what I'm hearing from you is that the desire, the natural wanting to be curious. You want to be curious, I want to be curious about what's happening for people, and just asking the open question, not making assumptions, allowing people to speak for themselves, to give them and indeed feel that we too have a voice, and to be confident that I do have a voice, and that I'm entitled to be able to say something about who I am and how I'm feeling in the moment. Though of course we all need to be a little bit cautious about that in terms of our professional roles. There's that word again, I'm using that word, professional. But what about those contexts though, when we seek to do that and we find ourselves in places of conflict? And whilst we want to be able to celebrate diversity and difference, there can be sometimes, there can be those difficult places where we think we're being true to ourselves, and someone challenges that in a way that doesn't feel to be helpful. And if I know from myself, from my own experience, I'm much better at it, but I tend to sort of turn away from conflicts and don't want to engage with it. Thank you very much. I don't know if you want to respond to that, Reena.
And I think conflict can be really difficult, especially perhaps when it might occur in teams where you're working with colleagues. And I think for me, it comes back to that sense of everybody needing to take responsibility to build that sense of safety. I guess it's also making me think of identifying who's in your support network, and whether there are support networks wider than teams or services that we're perhaps based in that we can link into. So thinking about the equality networks that the Trust runs, that was one of the reasons that I initially joined, because I was curious to see and to link up with members of the Trust in different disciplines as well. And I think that really helps with learning as well. But it's almost, I guess the word that's coming to mind is almost allies as well, of knowing who's there to support you. And I think that's really, really important. One of the things that I really like and value about the networks in the Trust, the equality networks, is that chairs and members from each of the networks go to each other's networks to support and to learn, and that feels really, really positive and inclusive. And I've not seen that so much in other trusts before, so I think that's definitely something we should kind of acknowledge, I think that we are doing well.
Very definitely. I think just to say, we are joined by people from across the country, so we'll have people here who have different, other experiences too, in terms of their how trusts organise themselves in terms of their equality and diversity and inclusion. But I just wanted to also, there are a number of questions, but Abdullah, one of our previous speakers, has asked the question: how can we remain distinct and confident, yet accepted by others who do not recognise that difference is understood or known? Which is a pretty good question, but seems to relate to what we're seeking to say, really. What's your thinking about that one?
I guess when I think about being authentic, it for me feels like quite a dynamic process in terms of thinking about the situations that we're in, who we're perhaps surrounded by, but also, I guess, thinking about the benefits. So if we are our true selves, are we likely to be more productive? Are we likely to feel happier? So I think it's thinking about what the pros are, and in terms of, I guess, what some of the challenges might be. I think that's one of the things that we're discussing, is actually when do we feel constrained? And I think the reasons for that might vary within different settings. I'm just trying to go back to the question. So
it's how can we remain distinct and confident, yet accepted by others who do not recognise that difference is understood or known?
I guess I would really hope that the efforts that are being put into thinking about issues related to equality, diversity, inclusion help to shift that landscape. I think the way that we talk about ourselves, about identity, about aspects that of identity too, I think are starting to shift slightly, and I think that we are bringing more awareness and trying to be more curious. I think this is also, I guess, making me think of when we are in roles that perhaps might have a sense of who we need to be within those professional roles, and the room that we have to bring individuality. And I think if we are working in particular services, I think there's something around focusing on what the job role is, and I guess aspects that we need to kind of perform in terms of the job role, but also then trying to look for avenues in which we can bring our individuality in as well. So are there things that we can shape in our teams, in our work, when we're thinking about perhaps people that might not be so supportive of individuality? One of the things that I think is really helpful is, can we do things together? So often removing that sense of having to face things alone. And I think that's where I come back to support networks. So are there group initiatives? Are there things that we can do within our trusts, within services, to try and encourage more of an inclusive culture? And I think one of the things that I've noticed working in teams as well across different trusts is that when we get busy as health professionals, we tend to drop some of those reflective spaces. We tend to drop the team meetings, and what that does is it impacts on our ability to connect with each other, and I think those things are so important. So I guess just being mindful that when we are really busy, that we still pay attention to building the foundations of the team and services with each other. So that going back to that communication and connection, I think, is key.
So community is important, isn't it? And identifying, sometimes we have to identify what that community is. We may not be entirely clear about that. We could talk about teams, we can talk about an organisation, but I agree with you in that sense with the pandemic. Whilst this virtual world is incredibly helpful, it has a really big downside in terms of not being able to necessarily have the space. And when there's a crisis, we don't have that space to be able to reflect properly and to engage one with another and listen and learn, and as you say, be curious. There's a really interesting, I think, quite a challenging kind of question that's come in that relates to culture. And And that's around, are we not all born into a culture not of our choosing? And if so, can we be authentic? My goodness. Well, I won't answer that first, Reena. So over to you first.
Thank you very much, Guy. Appreciate that. No, it's a really, really interesting question. And I think it depends on how we define culture. So for me, culture is a term that can encompass several aspects of, I guess, ourselves, but learning, things that we're exposed to as well. And again, culture for me is very dynamic. So I think if we're thinking about this, I think we are perhaps predisposed in some aspects in terms of the way that we might think and thinking about kind of communities and growing up. But I think authenticity is about that individuality. So I think there is still room for us to be authentic and individuals within those wider structures. That would be my view. What are your thoughts, Guy?
No, I think that's right. We are born into a culture, and yet, yes, there's so much that isn't of my choosing. I was joking with colleagues before on talking about this project, and we're talking about culture, and I just suggested that actually, because I'm from Yorkshire, nobody could possibly understand my culture, which isn't of course true. But we can still be authentic, I think. I'm sure we can, and true to ourselves, if we are recognizing and valuing difference. And culture is it's often a word it can be very helpful, but it can be really unhelpful. So we talk about culture often when we mean something quite different, I think. So often we'll talk to me in my role as a chaplain as to kind of, well, they have particular cultural needs which we need to identify and understand. I'm talking about perhaps patients or clients. And I'll say something about, well, what do you mean by that? Because do you mean they have a particular faith or belief? Oh, yes, no, I do. Yes, that's what I mean. Well, there are overlaps, but that's not the same. So there's an important thing to be highlighted there, I think. So moving on to one or two more questions. So there's something about, so someone's saying this, Abdullah again. Thank you, Abdullah. You always pose the most challenging questions in a really good way. There's something about recognizing that as a people we have been conquered, colonized, and for some enslaved, and to allow our inheritance not to drown out our spirits and heritage of self. So not a question as such, but a very important reminder that for many of us, and not indeed all of us, I guess, if we're looking back in history, have been colonized, and many of us have been enslaved, and perhaps need to acknowledge and understand our inheritance. What would your response be to that, Reena?
Absolutely. I think it's really important to recognise our histories and the histories of our ancestors too. I think it's important to recognise where the struggles have been. And I think one thing that we perhaps don't always do is think about the resilience that people from minority ethnic backgrounds may have based on some of those difficulties that we've had to experience. So I think, again, it's about that being curious and asking and not making assumptions. I think that's where it becomes difficult for me, where we might make assumptions of what somebody's experience might be, or make assumptions on what we can see. So John Burnham talks a lot about social graces, and this is the sense that we all have very different aspects of our identity. So, for example, if we're thinking about culture, sexuality, religion, spirituality, gender, ability, class, geography, all of those things. Now, we only have some of those differences that are visible. A lot of them are invisible. And some of them aren't voiced, so we don't know about them. So I think, again, for me, it's about really being careful that we do treat each other as individuals and also patients that we see during our working lives too, because I think we can often make assumptions and those assumptions may not always be correct. So we just need to be careful that we are always remaining curious, and what may be important to me may not be as important to you, Guy, for example, and there might be particular aspects of our identity that are prominent at different parts of our lives. So I think for me, coming back to that idea that actually our sense of self can be quite dynamic, it can change, it can vary, and it's a way of, I guess, being curious and staying connected to that.
No, I agree that, you know, it's not a fixed. These things aren't fixed. They are dynamic. They do change. I change. We change, and the mistake that we can, or I can make sometimes, is not recognizing that we do change, and the person I'm spoken to, perhaps I haven't spoken for a while, has changed. I've changed, and my responses change. Very important. I
think for me, sorry, just to nip in, I think it also brings to mind an exercise that I tend to do when I'm supervising others. So it's an exercise called My Cultural Self, and it's by Bobes and Bobes. So it's this sense of having space to think about, who am I? What makes me me? And thinking about the multiple dimensions that make us us. So thinking about which dimensions might feel easier to embrace. So that might be in a particular context, or it might be at a particular point in our lives. Are there any dimensions that perhaps don't feel as easy to embrace? And then recognizing that actually some of those cultural dimensions that we possess, some of them might be linked to a sense of pride, but there might be some dimensions that are linked to a sense of discomfort. So I think, you know, having that space to actually think about, when I guess we're talking about this in the context of work. So when I'm at work, are there particular dimensions of me that I am easily able to share or be or embrace? When I'm at work, are there particular aspects that I feel I need to hold back? Are there aspects that might cause pain or distress or might feel more difficult to explore? And I guess that links to some of the questions that we've had. But also, are there particular dimensions that are linked to that sense of pride? Because when we're talking about diversity and difference, I think one of the things that sometimes we can fall into is thinking about that as being a negative or problematic, when actually it's about celebrating difference and diversity and being and you know, seeing as bringing that to the workplace as enriching the experience and the environment as well. And I appreciate that that can be tricky to do, but I think it's important to hold on to the importance of diversity and what it can add to the workplace.
I'm sure that's right, and one of the mistakes that sometimes is made, isn't it, that is that somehow equality must mean that we all have to do the same thing or be the same in the same way, which is of course just not at all true. But how we actually celebrate difference and really affirm each other in that sense. It takes time, as you say. It takes there's a process of engaging and being curious and listening one to another. The question that I have just to touch on is that I can see is about being authentic. How does being authentic relate to the need to adapt? And I think maybe that we've perhaps touched on that. You know, we do, as you say, it's a dynamic where we change, we grow, we hopefully in our work, particularly I think in mental health care, but I'm sure within all spheres of healthcare, that desire and need to be self-aware, continually checking in with ourselves, checking in with others, discovering our own truth. But how does that relate to the need to adapt? I'm not sure. Can you say any more about that? I'm not sure.
I guess for me that ties into what we were talking about in terms of professionalism and the standards and our roles. And I'm very aware from speaking to colleagues from different ethnic backgrounds, I guess, of a fear of actually, if I'm my true self, will that potentially hold me back in certain ways in terms of people have talked about promotion prospects? Interestingly, I watched some YouTube TED Talks on YouTube, again in preparation for helping me think about this, and I watched 2 videos. One was from a white male and one was from a black female, and they were both on being authentic at work. The message from the video with the white male was very much bring yourself to work, be confident, embrace who you are, and be confident. Yeah, be proud of yourself. And the video message from the black female that I watched was the sense of actually this is the ideal situation, but then being faced with that sense of actually, if I do that, am I fitting in with the idea of the person that I need to be to fulfill this role? And if I am my absolute true self, and I bring my cultural, spiritual, self to my workplace, could that go against me in any way? And it was a really interesting difference, I guess, in how those messages were portrayed. So again, it made me think about intersectionality, thinking about gender, culture, age, different workplaces. So I think, that's a point for discussion, that actually we need to acknowledge that it might not always feel so easy to be our authentic selves at work. And it might be that we have degrees of authenticity that we can display or kind of engage in. But then the other part of it is actually, is that okay? And is it us that should be adapting, or is it our workplaces and our view of what's appropriate in different settings? So I know I've answered that with a question, but it's really, I guess it comes back to that. It's really made me think about that.
We have to keep safe, don't we? I mean, if and we've seen this in the pandemic, and indeed during the consultation groups that we've run, that if people don't feel safe, then they feel as if their authentic self is being denied, and their voice has not been heard, or sometimes even there's an unwillingness on behalf of some people within an organisation to be prepared to even engage, which is the sadness and the opposite. So you can understand the reluctance, perhaps, if we feel as if by raising our head above the parapet in some way, we might get hurt. It might be distressing. I'm just mindful that we've got a good 15 minutes or so left, but let's to engage with some of the other questions. Before we try to be anything in work, do we not have to start from the premise that work is inherently a place structured around relationships of power? The NHS is a particularly hierarchical institution. And I guess that's a little bit about what I was saying, that some people don't feel confident or understood in a place that is so, can be, around power, and therefore feeling powerless. How do you feel about that, Reena?
I think, yeah, so this comes back to that idea of professionalism again, doesn't it? And about how we define that. And I think in order for organisations to be able to function, we obviously need those rules and those boundaries, so that as staff members, we know what's expected of us, and we know what's appropriate, and we keep ourselves safe, and we also keep patients safe. So I think we do need that sense of, I guess, our guidelines and boundaries. And I think, so I'm just linking, just reading one of the comments below that as well, around actually, if we are truly authentic at work, could that be a negative, and do we have different personas? And I suppose for me, it comes back to what is important for us. So again, for some people, it might not feel comfortable to go into work and, talk about your your inner kind of thoughts or feelings or your experiences, and that's okay. So again, I suppose not feeling pressured to do that if that doesn't feel right or comfortable or appropriate, but it's that sense of, I guess, being able to be true to your values and feeling comfortable within your teams and services at work. But yes, I think we need to fully recognise that there are those structures there. And I think part of that is to kind of help to keep ourselves and others, patients, safe. But I think creating that sense of safety within teams and services, for me, is absolutely key. I think that's really, really important, so that we're not penalised for bringing our aspects of ourselves that are important to us to work.
Yeah. Yes, and related to that, someone's actually made the really important point that it might not also be slightly healthy to not always bring one's authentic self to work, and instead learning to adapt oneself to others, holding back on certain things out of respect and care for others, always being one's authentic self, seeing things only from one's own perspective might stop oneself from understanding others. Yeah, I'm sure there's a truth. I'm sure there's a real truth to that. But that relates to what we were saying, doesn't it, Reena, do you think?
Yes, I think so. And I think it might be about, I guess, when I was thinking about this too, it was about thinking which aspects make us us, and are there different domains where we might feel more able to engage in those kind of settings where we're able to express that. So when we're thinking about being our authentic self, there might be particular domains where we share different aspects of ourselves. So it might not always be at work for some of the reasons that have been brought up. But I guess taking more of a rounded view. So if there are particular values or things that are important, are there other settings outside of work where you're also able to sort of link into your values and to feel that you're living in accordance with those? So I think, again, it depends for me very much on setting and what feels appropriate. And there is, we might have different aspects of our roles. So we might feel that we're able to perhaps be more open in meetings with some colleagues or some parts of our roles than others. So I think it's about still that sense of monitoring about what is appropriate and professional. So as I said, I'm really open-minded around kind of faith and belief and spirituality, but also recognising that actually if a patient asked me about my personal views, that I need to be careful that I'm not imposing them. So I said that's, I guess, where that sense of professionalism comes in. So it constantly feels like this balance between what's important to us and that importance of professionalism and I guess following our professional guidance and fulfilling our job roles, and again keeping ourselves safe but also our patients and each other safe.
Which is where the whole issue of boundaries is important, and keeping safe, being safe, and developing safe practice that enables boundaries to be clear.
I think that it's really important. Sorry to chip in there, Guy. It's really important, that sense of safety. And I think so. This is the process that I've been thinking about today, because at the start we were talking about actually the courage that it takes to be vulnerable. So while safety is important, just acknowledging that actually in order to be vulnerable it takes courage too. So are we being safe or are we being courageous, and how does that feel? Just to put that out there.
That's a really good question, isn't it? Oh, yeah, well, yes, we could spend a lot of time sort of thinking about that, in terms of safety and being real and being authentic. Yeah. Ria's made a very interesting point. She says, I think being authentic and being accepted represents one of the biggest challenges of being human, and trying to balance that is clearly a challenge. As there is, she says, who we are within ourselves and are happy about being too. Yeah, sorry, I'm trying to. As there is who we are within ourselves and are happy about being to then actually be that individual throughout all of our interactions. That's our control. I think she's talking about, so she's saying something similar, I think, in terms of control, and how we're received by others. And that version of ourselves, though, which, you know, seeing ourselves in the mirror sometimes can be a salutary moment, but something that perhaps we need to be aware of, and how others see us. But actually being aware, I think Ria's saying that sometimes she's suggesting that can be out of control, or we need to be able to manage it. And that comes into focus when perhaps we're being, or we feel as if we're being rejected, or we're not being accepted in some way. And I think from again, going back to the consultation groups, there are several staff who, yes, are very supportive and positive about their experience of organisations. There are others who feel that because of their experience of being rejected, that becomes very problematic for them, and therefore they become increasingly isolated and alone, and therefore potentially in that place also can add to and exacerbate any sense of alienation that can happen because people misunderstand that silence for something else. Don't know if you want to comment on that, Reena.
Yeah, I think thinking about what it means to be our authentic self, it's really difficult to do that without also considering the wider context. So thinking about our services, our NHS, our society in general too. And I think it's really tricky to be able to tease that apart. I guess one of the things that, so I was having a look at some of the comments as well there, and I think it seems like there is a lot of support for thinking about authenticity as being dynamic. And one of the things that I was thinking about was, do we sometimes try to classify things or categorize things into boxes? And do we really and truly embrace complexity? And is there space for that?
These are such important questions. They're so important. I mean, we all of us. I sometimes, you know, I find myself putting, you know, I put somebody in a box. It's not helpful. It's not going to allow them to be themselves. I said, or somehow we categorize people. And Andrew's saying that would authentic better be seen as an ongoing process in a relational context? That sounds like a positive way of thinking, isn't it? This is about, well, we overuse that word process, but it's a journey, if you like. It's a place of constant kind of ebb and flow. He talks about, in his own case, his own birth subculture in some ways gave him the sense of being something, but in other ways rejected me as a person. And my way of being authentic is to be something constantly discovered and rediscovered in conversation with that birth culture and with all the other subcultures. I love the idea of the subculture and recognizing what these other subcultures are. And that's how Andrew's saying we meet and I'll find ourselves part of throughout the whole of life and life's experience. I don't know if you've seen that comment, Reena.
Yeah, definitely. And I think that, you know, thinking about it as an ongoing process, I think is really, really important. And also that sense of it is likely to change over periods of our life. There might be particular aspects of ourselves that we feel more comfortable with. That might be due to our own experiences or due to, I guess, factors externally. But that sense of, I guess, being constantly discovered and rediscovered, I think Andrew mentioned, I think is really important, and it ties into that, you know, that we're all changing, we're all developing, we are all influenced by our experiences, but also what's going around us as well, going on around us, which is, I guess, what makes me hopeful, because I think we have a lot of work to do generally when it comes to equality, diversity and inclusion, But I really do think that having these conversations more openly and bringing these issues to the fore is helping us to be more aware. And I think that awareness is key to be able to try and implement change. I guess if we think about awareness as being a bit of a cognitive process, thinking about what we know, the next bit for me is around the sensitivity, which is where we then link in more to our emotions and is more of an effective process. So then we start to think about, we move from that position of just knowing, but thinking more about how we relate to each other, how we see each other, how we work with each other. And then moving on to this stage, I guess, of cultural competency, which for me is around being able to combine our knowledge and awareness and that sensitivity that we show ourselves and others as well. But also for me, that cultural competency also includes that sense of humility, of being able to say what we don't know or what we would like to find out more about. And I think that's the bit for me where, you know, it's really important to be curious when we're thinking about our relationships with each other. So I think we have a responsibility ourselves, but also we have a responsibility to help and support each other and to support our team cultures too.
Something important, I think, that resonates for me is the sense in which we so often live in our heads, and we need somehow to embody difference, so it's and as you say, that need to engage with what we're feeling and to understand it, and sometimes a very visceral kind of sense of how we're responding to a particular context or situation, and seeking to understand what that's about and how people are affecting us in a particular way because of what they've said or what they've done or what they've experienced or what we've experienced together. And we often, don't we work in organizations where we are faced with sometimes some almost unbearable truths and some very challenging situations where life and death is very fragile, and knowing then what's happening to us in that wider context of our work and our organisation, with our patients, with our clients, with our colleagues, with our students. I'm conscious of the time, but I think some really rich comments and questions here. Steve says he manages a small team and tries to learn from unpleasant experiences with previous managers and tries to be the best leader that I can and lead by example. I still feel that trying to offer a nice culture and a nice place, a nice culture and a nice workplace for colleagues can be seen as a weakness. And I think we all have big challenges in the workplace. Yeah, again, I think it's about perception, isn't it? And it's very sad that can be seen, I think, as a weakness. But yeah. And someone else has said, when linking with our assumptions made of people and patients, is some of this not linked with how the roles are trained, with stereotypes used as examples of what to change? Well, gosh. All of us use sometimes stereotypes. We need to be so cautious of that, don't we, in terms of our reflections. There's so much here that we're not going to have time to read them all out, but perhaps one more. I think it would be difficult to adapt a workplace for all the different authentic categories that would need to be looked at. I think we can adapt to a point, and then it's up to the individual to adapt the workplace to them. That's an interesting comment. I don't know what you think about Reena, just a very finally, as we approach the end of our session. Is there a comment you'd like to make about that one?
That's quite a big question, isn't it? I guess
it's a bit unfair, but yeah.
For me, it's about that sense of responsibility. And actually, if we're thinking about changing our team culture or service cultures and making it more comfortable, making our environments kind of more, or staff and each other feel comfortable in our environment, it's actually, for me, thinking about what responsibility do we all have. And I think sometimes we can put quite a lot of responsibility on individuals from ethnic minority backgrounds to bring the change. So I think for me, it's about that shared responsibility and that shared understanding. And I think linked to that, as in a bit of a takeaway point, might be just to perhaps think about what the conversational waterline is in your team. So what's being talked about, and actually what perhaps isn't talked about, and is there a reason for that? So I think starting to begin those conversations, I think, is useful, and it might be helpful to have those in smaller groups rather than, you know, implementing that into the wider team discussion so that it feels more comfortable. But for me, I think, again, it comes back to that support and thinking about how we can support each other to make sustainable and meaningful change rather than that falling on individuals.
Thank you, Reena, so much. Thank you so much. And I think that is a really good place to end, and how we support each other in making those kinds of changes. Juliet, I'm going to hand over to you for your final comments for the, or instructions, I should say.
Sorry, thank you, Guy and Reena. That was a really wonderful conversation, and thank you for encouraging more interaction from the people attending. We've had like our highest number of kind of thoughts and ideas, I think, in this webinar, so it's been a really great discussion. Thank you so much. So just quickly then, just to say, it would be really helpful to have feedback from people here, and I'll be emailing a feedback form to most people shortly, and it will be anonymous, and it would be really helpful if people don't mind filling that in. And then if I just bring up this last slide, next we have one more webinar remaining in the series. For full details, click on the link in the Q&A section or go to the web address appearing on the slide now. A reminder that our next webinar, will be with Charmaine D'Souza, Chief People Officer, Oxford Health NHS Trust, on Thursday, 17th of March. And a reminder that all these webinars are being recorded and will be put on the webpage later. In the meantime, thank you everybody for attending, and have a good evening.